So for our study, we're going to be discussing proactive teaching strategies to mitigate and respond to anxiety and depression, specifically in a Catholic secondary education classroom. So our research question is, how can teachers respond to the increasing needs of high school students who suffer from anxiety and depression in their classrooms? So a brief synopsis of the purpose that we came up with is we expect that cases of anxiety and depression are going to increase due to the events of the past 16 months. So as Catholic school teachers, we are required to meet the needs of all of our students, and actually per the Catholic social teaching, we're required to and called to meet the needs of all of our students. So the purpose that we're trying to fulfill is we are trying to figure out how can we successfully mitigate the symptoms of anxiety and depression at the classroom level, but also beyond in the entire school as well. So a quick little connection, the Great Recession in 2008, mental health cases skyrocketed, and researchers found a very big significant increase. And we also expect a significant increase due to the COVID-19 pandemic as well. There was a brief study done in China, and 54% of participants said that they struggled with mental health due to the COVID-19 pandemic. And we expect these results to also correlate directly to the United States, but also we actually expect them to be higher with adolescents. So the challenges are at various levels, but the article argues at the community, family, and also individual with quarantine-specific challenges. So at the community level, an example would be mandated shutdowns, and this trickles then down to family structures and the family level. So once individuals have to quarantine all as a family or as a home unit, then this has a significant impact on individuals. And a quarantine-specific challenge is that individuals feel that they have a decreased sense of freedom and privacy. And so all of these manifesting symptoms ultimately do lead to anxiety and depression. So as educators, we need to know that our students are coming into our classrooms with these challenges. So some important statistics that we know reported specifically with Catholic schools. There's an article from 2020 that stated that 5.1% of students in a Catholic school have a diagnosed disability. And then also 78.4% of all Catholic schools serve students with mild to moderate disabilities. So these disabilities, the high incidence disabilities, make up 80% of the student population with the disabilities under IDEA. And why this is so relevant to us is because anxiety and depression are in the top three, most prevalent and most notable. But what's important is that Catholic schools are not required to accept students with disabilities under IDEA. So some explicit connections to Catholic social teaching. Torvell argues that when we suffer with symptoms of depression and anxiety, these are interrelated with the suffering of Christ. So ultimately what we're doing is bringing the revelation of Christ full circle. So the three principles that we are seeing connected to Catholic social teaching are the call to family, community, and participation, the principle of solidarity, and also the need to help the poor and the marginalized as well. And so what can we do specifically as ACE teachers? The biggest thing, have a successful model of inclusion in your classroom. Think about the policies, procedures, and plans that you're going to have in place, and think, how can I accommodate for students who are coming in who suffer from anxiety and depression? And the article from 2020 also argues that the majority of teacher prep programs really only have one course in successful inclusive teaching practices and evidence-based practices. So having this knowledge, we need to know this is the faculty and staff that we're going to be working with, and we need to be able to reasonably accommodate for students who have these symptoms of anxiety and depression.
Transitioning from our introduction here, keep in mind the responsibility educators have in meeting our students where they are. As we continue, I will be discussing how we can identify the signs of anxiety and depression in adolescents when they are in our classroom. Together, we will touch on comorbidity and warning signs and symptoms with anxiety and depression, the differences in how anxiety and depression are viewed by gender. Further, we will explore diagnosis patterns and the impacts of cultural identity. Anxiety is characterized by excessive worry concerning numerous events across a range of life domains, like in the home, social life, interactions with others, and even self in terms of internal dialogue and emotion. Anxiety can manifest as restlessness, fatigue, difficulty concentrating, and it can even show itself in physical wellness as well. As I mentioned these symptoms, start to picture what that looks like in a high school classroom. These symptoms can disturb academic performance, responses to various situations, and can further frustrate social interactions. In the year 2012, the WHO classified depression as the leading cause of disability for all ages and genders, which demonstrates the importance of understanding, diagnosing, and treating this illness. Depression is characterized by experiencing life-altering events like losing a loved one, experiencing abuse or sexual assault, and more. As I mentioned earlier, anxiety and depression can be comorbid, and so I highlighted many of the overlapping symptoms that depression and anxiety share. As mentioned by Morey and O'Lawrence, unfortunately, many people who experience symptoms never do get diagnosed or treated for their illness, and in many cases, this can lead to suicidal thoughts or life-ending events. It is vital that we recognize these warning signs and symptoms of anxiety and depression to administer as much help as possible. I want to first note here that research discusses data and findings specifically as binary genders. So in this time of adolescence, boys and girls undergo puberty. Research suggests in multiple articles that the incidence of depressive disorders noticeably increases as adolescents reach puberty. So looking first at boys, their development experience during puberty is largely welcomed by society. So in other words, boys tend to be adept at creating a social network that supports their changing bodies and development during puberty. And we really do become concerned with the adolescent boys who may not be developing as quickly as their peers are, because as a result, there can be an internalization of low body image and a difficulty expressing their feelings and emotions. If we turn to adolescent girls, their attitudes regarding their physical appearance often become more negative with the mixture of societal pressures. So in addition to this, hormonal changes during menstruation are not usually discussed at this critical age, and that can lead to a lack of awareness and coping strategies to handle these changes and incidences of stress, which can culminate and lead to depression and anxiety symptoms in females. Research has shown that there is a lack of understanding or just a lack of data to show how adolescent girls and boys living with anxiety and depression show these behaviors in classrooms. Largely, we find that both boys and girls tend to disengage from school and social domains within their lives. Boys tend to show increases in outbursts and shutdown behaviors. This follows from the struggle of adolescent boys expressing their feelings and emotions. For girls, on the other hand, as they speak about their stresses, emotions, and feelings, they tend to ruminate or turn inwards and really not engage with authority figures that could be helpful in those situations. Mentioned by Thapar, adolescents are diagnosed with anxiety and or depression with the same criteria as adults. Therefore, adolescents that are experiencing anxiety and depression symptoms but do not pass the diagnosis threshold, they may be just left untreated, and this can become severe down the line. So the ability to perform in school may be affected by symptoms and anxieties of anxiety and depression, such as decreased interest, loss of energy, insomnia, diminished ability to think and concentrate. So anxiety and depression do affect the students sitting in front of us. As we have these students in front of us, it is important to educate them about their bodies and their minds and make them aware of these disorders. There is and should be an urgency to develop programs that can provide education and reduce the stigma surrounding mental health issues, regardless of gender. Culturally, there are very different ideas about mental health crises. Parents may not allow their students to see and be officially diagnosed for these disorders. Regardless of familial beliefs, the students that are in front of us may be suffering, and we as teachers need to be aware of how to work with these students to give them the support they need and they very much deserve.
Well, Colette importantly told us about some of the symptoms of anxiety and depression. I'll be focusing specifically on what the ramifications of those symptoms are in school. So those students with anxiety and or depression will experience their mental distress individually and differently. The symptoms can manifest in the classroom in similarly detrimental ways. And multiple research studies that I'll go over, anxiety and depression have shown to affect students in both social and emotional circumstances and within academic tasks. Specifically, depression and anxiety seem to affect students' sense of belonging, notably a fear of isolation and a lack of confidence, and academically through decreased productivity, efficacy, and performance. So sense of belonging, the first social area that's affected, is the extent to which students feel personally accepted and included and supported by their peers and teachers in the school social environment. Students' perception of belonging in the classroom is actually predictive of future depressive symptoms in both genders, anxiety in girls, and behavioral issues in boys. So high school students with anxiety can also express excessive worries about past behavior, self-image, competence, and socio-sexual acceptance, causing them to fear isolation at school. According to Bernal Morales' research, students with anxiety display excessive perfectionism, social phobia, and other anxiety disorders that exacerbate the challenges that students face to socially fit in an academic and academically excel in the high school environment. Depression and anxiety can also substantially decrease adolescents' confidence. Many women, as Colette explained, begin their menstrual cycle for the first time in high school and can actually develop premenstrual dysphoric disorder, which causes body image dissatisfaction, feelings of failure, concentration problems, and work difficulties. In high school boys, alternatively, they are more likely to suffer from elevated feelings of boredom and an inability to feel pleasure. Both of these things are characteristics of depression. Symptoms of anxiety and depression can impair high school students' academic achievement as well through decreased productivity, efficacy, and performance. So in a longitudinal study of secondary school students, McArdle found that students with greater symptoms of anxiety and depression displayed lower academic achievement. Adolescents who have severe depression are also more likely than adults to present their condition with irritability, suicidal ideation, and hypersomnia, which can severely affect students' ability to complete schoolwork. Anxiety also deteriorates the habitual activity of individuals, potentially leading students to display lower rates of efficacy, especially when they're trying to get work done. In their research here, Humunsky et al. Found among students ages 14 to 21 that major symptoms of depression interfered with subjective measures of school performance, including the ability to do well in school, homework completion, concentration, interaction with peers, and simply attendance. Additionally, research found a positive correlation between the severity of depressive symptoms among teenage students and concentration difficulties, self-learning, poor academic performance, and lower proficiency in reading and writing. While the symptoms of anxiety and depression in students may manifest in different characteristics based on illness, gender, age, race, ethnicity, socioeconomic status, and especially comorbidity, teachers and schools must play a role in mitigating the harmful effects of mental illnesses on students' education.
So knowing that depression and anxiety affect academic performance and the well-being of our students, we can take a look at what's being done to support these students in our schools. This is a very top-down approach where you can see various levels starting from the school community level. And so based on the Individuals with Disabilities Education Act, the responsibility for students' mental health is put on the education system, specifically for those students whose mental health affect their educational success, which Claire had just pointed out. A responsibility of the school is there's an obligation to educate their faculty in how to train professionals in addressing students with depression and anxiety and other mental health disorders, ultimately to improve student well-being and their academic performance. This first starts with the entire school community, creating that environment that's safe and fosters a positive growth of mental health, and specifically that then looks into educating in a mental health program. So the programs that you see here are just examples of some that are federally administered and also some that are private. All these programs have been historically implemented with a goal to improve mental health literacy among the professionals that receive this training. And specifically, the professionals that receive this training are working with at-risk populations, educators being at the top of that list, serving their students. Several of these programs improve understanding of mental health knowledge, familiarity of the disorders, and treatment styles, while decreasing attitudes towards mental health disorders that are negative, but increasing help-seeking behaviors and efficacy. So some successes from these mental health program interventions are improving, again, the knowledge, the preparedness of these faculty members, the educators that are serving their students, and willingness to intervene. Faculty who have received this training and are more likely to intervene and support their students that struggle with mental health, specifically anxiety and depression. Some preventative strategies on the educator's forefront are implemented, again, like we said, at that top-down approach, first into the classroom or at the community level, and then serving the majority of their students, but also teaching intervention methods so that they can intervene with the 20% of the students who are showcasing the symptoms of depression and anxiety that Colette had mentioned previously in the presentation. Some improvements that we looked at while investigating these programs that have been implemented are many of these programs are implemented at the very beginning of this academic year, where research has shown that continuous training has showed better outcomes for educator intervention. A lot of these studies need further research in how we can cater to minority students in improving their mental health, especially after the COVID-19 pandemic. And also further research needs to be considered in how we improve these help-seeking behaviors and outcomes for teachers.
All right, so having looked at the call and the responsibility for serving our students, the need and the urgency for us to understand anxiety and depression, and then what's being done on a whole school level, let's turn now to some individual strategies that we as educators can implement in our particular learning environments. So first, looking at sort of how can we serve all of our students, that general classroom culture, talking about student mindset and skills, the physical space of our classrooms, and then how to involve parents in that conversation. Then moving into what do we do for students who have more acute needs, where we have to go on a more individualized basis, utilizing availability, trust, and then the training that we're given as educators. So the first thing to pay attention to is the way that we can help our students cultivate helpful mindsets and skills in the classroom. So we know that growth mindset and grit can help students academically. Growth mindset being that belief that through inputting time and practice, we can improve our abilities. There's not this sort of set rate at which we're given intelligence or other capabilities. And grit being sort of what we think of as persistence and stick-to-itiveness. There are more technical definitions on the slides, but the important thing is not just that those things can support our students academically, but that marrying the two of them can help increase resilience, that tendency to recover from adversity or a depressing process like anxiety or depression. So cultivating growth mindset in our students, helping them to increase their levels of grit, can prepare them to overcome setbacks, not only in classwork, but also in other social and emotional situations. So some strategies for improving growth mindset: teach your students about how their brains work, the fact that they're still changing during this developmental period of their life, and that anxiety and depression can have roots in their brain. Giving them that knowledge is going to empower them to take ownership of their experience. Normalize making mistakes in the classroom, not just in their schoolwork, but also in the fact that they're young and we're all going to make mistakes over the course of their lives. Teaching them that that is normal and livable is going to help them to cope with the symptoms that they might be experiencing. Practice positive self-talk. Model for your students how to have a positive outlook in the challenges that they're facing. This is going to help give them the tools that they need to do it on their own when we're not there. And then finally, set goals with your students and include them in tracking the progress that they're making towards those goals, both in the classroom and outside of it. Another tool that teachers have in our little back pocket here is social and emotional learning. So SEL allows students to cultivate knowledge, skills, and attitudes that they need for positive social and emotional functioning in these 5 key competencies. So self-awareness and self-management, social awareness and relationship skills, and then responsible decision-making, all things that based on what Colette and Claire talked about, we know that anxiety and depression can cause inhibitions in. So SEL has been shown to have positive impacts in students' mental health. And by giving students tools and resources to improve in these areas, we're going to help set them up for success in coping with and possibly mitigating their experience with anxiety and depression. So utilizing mindfulness and reflection in your classroom is going to help give them opportunities to grow in these skills. Again, just as with growth mindset and grit, modeling the behavior that you want to see, and then giving students strategies to cooperate with each other and really build up that sense of belonging that students can lose from anxiety and depression. Just anecdotally, we know that environment can have an impact on our mental state. So it's crucial that we create calm, safe, welcoming environments that are mindful of the fact that your physical space has an impact on you. So 2 things specifically to touch on here: the way that we set up our classrooms with regard to flexible seating can be a powerful tool for empowering students with choice, accommodating their different learning styles, and then increasing opportunities for engagement and peer interaction. So again, reducing that sense of isolation and boosting the feeling of belonging. Lighting and color can also be utilized. Combining natural lighting with artificial lighting instead of having just bright fluorescence on all of the time can have an impact on mood and productivity, as well as utilizing vibrant and/or soothing colors. We all know that it's nicer to be in a calm, soothing space than bright white walls and fluorescent lighting. So utilizing that can be helpful for students as well. Involve your parents. It's really crucial that parents are involved. Research has found that getting your parents involved can improve not only students' academic functioning, but also their emotional functioning. So at the beginning of the year, send out surveys to your parents so that they can give feedback and input about their students' learning history, how they learn best, but also any other sorts of information they might feel is relevant for you to know as an educator. This might be an opportunity for them to share something about their children's mental health history. It also opens the door to frequent and open communication between you and your parents, so that if you should see something that concerns you or you observe something in your classroom that you feel they need to know, you have the ability to keep that conversation going. Moving from that overview of how do we meet the needs of all of our students to looking more towards how we meet the more acute symptoms that some of our individual students might show. This is where it's important for us to be available and to cultivate relationships of trust with our students. Teachers who are visible and approachable are better able to support their students. So go to their games, be present in the hallways, make it so that students know that you're interested in their lives outside of the 4 walls of your classroom. This is going to help you to build those teacher-student relationships and lay a foundation of trust, which is essential for mitigating negative symptoms and responding to the more severe circumstances that come up. Finally, to go back to what Michael was discussing with the essential aspect of training our teachers need to be properly trained as well as willing to act as gatekeepers for mental health awareness and suicide prevention. So in the case that a student does come to you with a more extreme concern, you know what to do and feel empowered to serve your student to the best of your ability in that moment. So the last thing we want to leave you with is the fact that you're an advocate for your students. Don't be afraid to be the voice that advocates for further mental health supports and education so you can better serve your students who struggle with anxiety and depression. Thank you.